Hi everyone, and welcome to our very first CareFlex webinar session. I'm so excited to be bringing this webinar series to you, and I hope that you learn some new hints and tips on specialist seating along the way. I want to use the first session to emphasise the importance of specialist seating and why it's a piece of equipment that we promote for use with clients. The main focus of the session will be the benefits to the client. In future sessions, we will be looking at the benefits to the client support network, as they are a vital part of the care plan, and also some of the clinical justifications and cost effectiveness too. The session will be around 15 minutes, so please get yourself comfortable and get your pen and paper ready to take some notes. Don't hesitate to contact us at the end of the session if you have any questions or any client-specific queries. We're also open to feedback if there are any topics you wish for us to cover in future webinar sessions. Thank you and enjoy. Let's get started. I want to begin by setting the scene. Adults average around 9.5 hours every day of sedentary time. Between the ages of 65 and 74, this can increase to 10 or more hours. And by age 75, people are sitting on average for a staggering 11 hours every day. Remember, for our clients who are wheelchair users or those with limited mobility, these figures could be even higher. As clinicians, it can often be difficult to reduce these figures, either due to the client's injury, illness or disease, which is why it's so important that clients who are sitting for prolonged periods of time are prescribed appropriate specialist seating as part of their care plan. Inappropriate postural management can exacerbate existing physical and medical conditions, ultimately reducing quality of life for our clients. In future webinar sessions, we will be looking at posture in more detail, what we mean by good posture and how we can achieve it through specialist seating. But I think it's important that we do a quick recap just to further set the scene. So good posture in relation to specialist seating will facilitate effective functional performance and encourage engagement in activities of daily living. Good posture will be energy efficient, so the client should not become easily fatigued within the chair. Good posture will also not harm the body systems, so hopefully reducing the risk of secondary complications and protecting the body. Briefly, looking at what can cause postural problems. So postural attitudes, everyone is different and everyone will have their preferred postures that will become habitual to them. This is completely normal. But when those preferred postures become abnormal or prolonged, this is where we can start seeing postural challenges. Gravity will have a significant impact on the body. It's difficult enough to be able to hold ourselves upright and erect against gravity. But then for our clients who have those added damage to the body systems, it can become very difficult, and quickly we can start seeing problems with posture, such as asymmetries and unequal loading on tissues. So in these instances with clients who do have damage to the body systems, who are particularly finding it difficult to hold themselves upright against gravity, this is when we need to be considering specialist seating. The aim would be to identify those at risk before those postural challenges set in. This list isn't exhaustive, but I hope it gives you some idea of the objectives the specialist seating aims to meet. Promoting comfort, relaxation and feelings of safety, decreasing fatigue and encouraging good energy management, providing a stable base of support with stability at the pelvis, which is so important for functional movement and participation in activities, facilitating normal movement patterns through normalizing tone or at least decreasing its abnormal influence on the body. Specialist seating also aims to prevent, delay or accommodate postural deterioration and, as mentioned, reduce the risk of those secondary complications. Specialist seating also aims to reduce the risk of pressure injuries by distributing pressure across the weight-bearing surface, so the user's body weight will be equally distributed throughout the chair. From a health and safety point of view, specialist seating is a key piece of equipment in enhancing physiological functions such as digestion and respiration. And there's also a wellbeing aspect too, as specialist seating aims to improve interaction and engagement and development, and that social inclusion that we all know is so important for quality of life. As part of the prescription process, these are the areas that we need to focus on. Of course, the client, but also the client support network, as we often rely on them for consistent use and compliance with equipment. We also then have our clinical objectives, but there's also cost implications too, and we have a responsibility as clinicians to prescribe appropriately and use funds appropriately to hopefully ensure high quality services for many generations to come. And we need to ensure that we approach all these areas holistically, as this will ultimately lead to compliance with the piece of equipment to make sure that chair fits into daily life for the individual. As I said, today we will be focusing on the benefits to the client. Future webinar sessions will look at the other areas. Now for me, the top of my checklist is comfort. Our clients' request to be comfortable seems like a simple one, but often it can be taken for granted. Research has found that regardless of clinical benefits, the chair may not be used if the user is not comfortable. And I've seen this in my professional career too. So now that's why comfort is at the top of my list. At Careflex, the main objective that we want to achieve with our chairs is to enhance comfort and feelings of safety. Research has shown that proper positioning, which can be achieved through specialist seating, can have a significant impact on comfort levels and even reduce fatigue. Comfort is also essential in order to minimise pain that our clients may be experiencing, either due to abnormal muscle tone or reflexes. As mentioned earlier, seating can be effective in inhibiting this abnormal tone and reducing the influence that it has on the body. Moving on to function. Specialist seating aims to encourage independence and choice, not limit it. So a sitting posture that promotes good postural alignment is critical for functional movement. Our clients need to be able to use their upper limbs to be able to take them from a load-bearing role and reach outside of their base of support to be able to perform tasks and participate in activities of daily living. And the only way that they can achieve this is through stability. So specialist seating aims to promote this stability, starting at the pelvis and then working its way through the full body segments by offering a wide base of support and ensuring the client is in contact with as much of the chair as possible and this low centre of gravity. Research has shown that this freedom of movement that is so essential for performance and function is achievable once we have that effective stabilization at the pelvis and at the trunk. So this is why, again, specialist seating is key in getting that postural security and postural control. A standard seating would not offer some of our clients that necessary stability. Specialist seating and the way in which it is set up, as mentioned, can have an impact on the abnormal movement patterns that our clients may be presenting with and hopefully reduce the influence that they have on the body. The key message on this slide is the way in which the chair is set up. The setup can often be a simple step that is overlooked. So in future webinar sessions, we will be looking at chair setup in more detail, as this is a key part of the prescription. During this pandemic, now more than ever, people are beginning to realise how important our well-being is, that social interaction and engagement with our loved ones, with the outside world. But for some of our clients, this can be a daily challenge. The simple request to want to spend time with family in the lounge rather than being confined to their bed or the four walls of their bedroom is a request that we sadly often get presented with. A specialist seating will hopefully give our clients the opportunity to achieve this social interaction. So achieving a good stable posture can help our clients to participate more fully in activities of daily living, whether that's at home, school or work, but also feeling that sense of community and being part of something. To enable our clients to interact with their environment and with loved ones, head control is an essential part of the prescription process, as this is what gives them the orientation that they need to be able to interact and engage. An upright sitting position can offer our clients a better line of vision for interaction, but also the ability to achieve cognitive tasks too. Research has shown that the introduction of specialist seating systems at an appropriate age can also facilitate psychosocial and cognitive development. So for those of you who work with people with disabilities or intellectual disabilities, specialist seating can really benefit them by enhancing their ability to participate or learn new skills. I mentioned at the start of the session how important specialist seating is for our clients' health and safety. Now, enhancing physiological function is an area that can have a significant impact on their health. A major goal in postural management is to enhance this autonomic nervous system function. And our clients' inability to be able to sit upright can result in decline in overall health, and then this would be reflected in their altered physiological function. So trunk asymmetry, maybe gravity is taking control and we see our clients leaning to one side, or maybe they have postural deformities at the spine that's causing them to lean to one side, and they're presenting with these asymmetries, can have a significant impact on their ability to breathe effectively, to swallow, such as eating and drinking safely, digestion, cardiac efficiency, and even endurance. And I think it helps to visually see this impact. So this is an x-ray here of somebody's spine, and you can see the curve of the spine there, the scoliosis, and the impact that might be having on the internal organs. This is another image of a gentleman with hip and knee contractures, and sadly at this point difficult, if not impossible, to sit out. So not only do we have the compression of the internal organs from the postural deformities, but also the inability to sit out, meaning that gravity cannot help with that physiological function either, due to having to be lying supine or side lying in bed. This altered physiological function can have a significant impact on health and lead to health decline, as we've already seen. This can present in an increased risk of aspiration and infection. Maybe our clients are experiencing recurrent respiratory infections. There's also then an increased risk of related hospital admissions due to becoming severely unwell. Or maybe there is a need for surgical intervention for tight tendons or for orthopedic reasons. So this is why specialist seating is really key, and we need to prescribe it at the right time to reduce the risk of these instances happening. One aspect of specialist seating that's finally getting the recognition and awareness that it needs is pressure management. As we know, posture and pressure are inextricably linked, and the different body positions that our clients adopt have a direct influence on the pressure going through specific body sites. So if we don't manage posture and don't address this unequal loading and asymmetries that gravity can have an effect on, then we are increasing our clients' risk of developing pressure injuries. Now, sadly, pressure injuries in older persons, for those of you working in elderly care, are associated with a 5-fold increase in mortality. They can also result in longer lengths of stay in hospital for those of you working in acute settings. Research has shown that individuals who develop pressure injuries had an extended day of over 4 days, which, as we know, will have a major impact on their health outcomes. This is why we need specialist seating to encourage that equal weight distribution and use the functions of specialist seating to encourage regular weight redistribution and a regular change of position. With regards to health and safety, another area we need to touch upon is falls and an increased risk of falls, as poor postural control can result sadly in our clients sliding out of their chairs or falling during transfers if they don't have appropriate equipment in place. These falls can be devastating not only for the individual but for the wider healthcare system, as it is a costly issue. But as we're focusing on the client today, I can't stress enough how significant a fall the impact can be on clients, the distress, potential injury, loss of confidence, and then their reluctance to want to develop those skills further. So specialist seating and the functions such as tilting space, as long as it's appropriate and safe, can help encourage a safer sitting position. Good foot support will encourage that stability, but also ensuring things like seat height should help with improving transfers. As mentioned, further webinar sessions will go into more detail, so keep an eye out for those. I think it's evident by now how important specialist seating is for some of our clients, and the significant impact the specialist seating can have not only on their postural and pressure care needs, but also their health and well-being. Ultimately, we are clinicians because we want to improve our clients' quality of life. Failure to protect our client's body shape can result in many secondary complications, some of which we've covered today. But as I've mentioned, this is a brief introduction and our very first introduction into the world of specialist seating. And as this webinar series continues, we will go into these areas in more detail. I want to finish by recapping some of the points we've covered today. If we do not identify our clients who are at risk of postural deterioration, or those who have pressure care needs, and do not prescribe appropriate specialist seating when required, they are at an increased risk of pain and discomfort, contractures and postural deformities, poor physiological function, which can lead to a decline in health, reduced function and independence, social isolation and limited opportunity for participation, which can have a significant impact on their well-being, and reduced quality of life and even death. It's shocking to know that 52% of people with a learning disability die prematurely from respiratory-related conditions, which can be directly impacted by their posture. I hope I've made it clear enough that for some of our clients who are unable to manage their own postures or change positions independently, specialist seating is a key part of their care plan. As the webinar series continues, we will be touching on this in more detail. So I just want to finish by saying thank you for listening, and keep an eye out for our next webinar session, where we will be introducing posture and good posture and how specialist seating fits into that.